Welcome back to the Midlife Maverick podcast, the show for men who want to reclaim their vitality, strength, and purpose in the second half of life. Today, I'm joined by Jason Gilbert, a chiropractor, functional health educator, and a man who's walked through decades of back pain, spinal surgery, mercury toxicity, and burnout to come out the other side stronger at 55 than he was at 30. We dive into what really causes back pain, how movement and stress are deeply linked, the truth about detoxification, and why healing isn't just about doing more, but doing the right thing. And hey, if you're listening and you're ready to take better care of your health, don't do it alone. Join the free Midlife Mavericks school community, where men in midlife come together to train smarter, eat better, build connections, and take ownership of their health. You'll find tools for guidance and a brotherhood that's got your back. The link to join is in the show notes. Let's dive into this week's episode of the Midlife Mavericks podcast with Jason Gilbert. Jason, welcome to the Midlife Maverick podcast.
Stretch, thank you very much, mate, for the invite. I'm really excited to have a chat with you and get all the info out there.
Yeah, exactly, mate. I'm keen to connect too. You're in a beautiful part of the world up there in Lennox in New South Wales, and you're a keen surfer, I'm guessing.
Mate, keen surfer, it's one of the reasons I'm up here, but another reason is just a healthy lifestyle. I was in Latin America for 20 years, helped start chiropractic over there, studied functional health, but I was in big cities and desperate to come to a clean living place, which is exactly what Lennox Head is.
Yeah, exactly, mate. I can relate to that. I lived in London for many years and then was like, I got to get out of here. It's not doing me health any good. So.
Your soul craves it, doesn't it?
Funnily enough, when I left London, I ended up in Byron Bay, so not far away from you.
Oh, yeah, fair enough. Well, mate, when I went to South America for a surf trip, I was meant to be 6 months.
Yeah.
I just recently graduated as a chiropractor, saw that there was no chiropractors over there. Before I knew it, I was taking a table up to the Andes and the Amazon, treating the communities up there, and then invited to help start the first university program in Sao Paulo, Brazil. So a lot of our plans when we're younger don't take us to where we were originally thinking they would. You know, and 20 years later, how's that? 20 years later, I've come back to Australia.
Yeah, there you go. That's double me, mate. I was 10 years in London, but that's another story.
Yeah.
Jason, often when I kick off the podcast, there's a couple of questions I like to ask. The first one is, if you and I were to be boarding an airplane, where would that airplane be heading? Do you have a favorite holiday destination, or is there a bucket list item that you want to tick off?
Mate, look, I would say for its proximity and the variety that it offers, Bali. I know that Aussies love Bali. There's something for everybody. So if we were boarding that plane, I'd be telling you that I'd be combining surfing. Yeah, I'd go somewhere to surf, somewhere not so crowded, unless it's a little bigger and it spreads the crowd out. Somewhere that I could look after my health. I traditionally go to Ubud for at least a week or 10 days to, do some yoga, eat really healthy food, and just do sort of customize my own health retreat type situation. And more recently, Nusa Lembongan, because it's just like old Bali, nice and quiet. And you can, combine everything as well. What about yourself? Where would you go, mate?
Oh, the first person that's asked back, mate. So it's an interesting question. I get a lot of people. A lot of people always tell me Japan. Japan's on the high on the list. I've been there a few times for the snow, but I would like to get back and explore other parts of Japan. So hopefully in the future that'll happen.
Yeah, I
mate.
haven't been there. I'd love to go. It sounds amazing.
Yeah, it's a beautiful place, beautiful culture, very clean. Lots of good food there too, mate. So we could do that as well. So if we're sitting on this plane and we're off to Bali or we're off to Japan and we start up a conversation and I was to ask you, like, what's your mission in life right now? How would you answer that?
Hey, my mission in life is pretty much the same now as what it has been since I graduated from uni. And I think a lot of people are lucky to fall into what they were meant to do. And for me, I see that now. I didn't see it as clearly at the start of my career. That's to serve, to serve people through health. We owned a health food store when I was a kid. I worked there. I was fascinated by people's stories and particularly what the actual cause of their symptom was. Studied chiropractic, ended up in Latin America. So, there's a lot of dedication through that purpose to health and helping people via whether it was chiropractic or the World Surfing League. I've worked with them for 20 years and combining chiro and physio and lots of modalities to help restore function. And I guess within health, my purpose would be to restore function. It's not to turn down symptoms, make them ignore or not feel symptoms. It's to use those symptoms to find the underlying cause and correct it, teach them how to keep their body away from the original cause, and happy days. Then you're actually empowering someone. So a later stage of my purpose and I guess my evolution in my career is education.
Yeah, awesome, dude. I can tell just in the short conversation that we've had that you're very passionate about health, which is something we've both got in common. So let's
Yeah,
dive into that
yeah.
a little bit more. When did you decide that you were going to become a chiropractor? What led you down that path?
Mate, that happened there was a few things that happened around the same time. Um, we owned the health food store. I was fascinated by all the vitamins and all the stories from the elderly people in regards to the supplements or even foods that they were eating and why. I'd often observe, for example, an 80-year-old with impeccable posture and go, oh, well, maybe that's not a coincidence that they're still 80 or 90 and rocking it and they're straight, as opposed to 50s and 60-year-olds coming in sort of bent over. So there's a few little things that I started to do, joining the dots. I suffered back pain from a very early age. And around the age of 17, 18, when I was trying to decide what I was going to study, I was surfing with Tom Carroll, who's, three-time world surfing champ. And Tom recommended that I'd go to a chiropractor to help my back problem. And I went, and it was great. I went twice and I was without pain probably for a month or two. But just around the time Tom told me about that in the health food store, a guy came in, he said, what are you thinking of studying? And I told him science. He said, what are you going to do with that? Like work for a pharmaceutical company. And I didn't get that back then, what he meant. But he said, I'd just been to a chiropractor and I was hobbling in there and I'm fine now. And he basically said, look, why don't you think about studying chiropractic? And that's where it all started, mate.
Yeah, there you go, mate. You
Yeah.
mentioned back pain. You mentioned back pain there at a young age. What do you think led to your back pain?
Mate, back pain, oh my God, that's like looking at the wheel of a car and asking why it's misaligned. Was it the hole there, the bump there, the bush track there, so for me, something happened in childhood that would have been, I don't know, I used to jump off the first story of our house, influenced by a friend of mine, quite possibly that jarred it. Football, played rugby league,
Yeah,
heaps of falls. As kids, we have, they say, more than 2,000 falls in the first 5 years of life. So each one of those traumas can potentially misalign our spine. And what I learned now in this part of my career is that for most of us, when pain comes about, there's already that biomechanical dysfunction
mm,
that's chronic, combined with stress, combined with poor diet, combined with inflammatory lifestyle, and boom, there you have your symptoms. So I put up with that from about 7 to 18 years of age, and
wow.
like most of us, we believe that any intervention around pain is successful if it relieves you of your pain. And that's the same as what it is today. That was, as a kid, I recognized that that wasn't the case. But now I've got people doing treatments for all sorts of degenerative illnesses, and success with their doctors is seen as if they feel better. Or if they
Mm,
go and the tumor's not there on the scan anymore, but no one's looked at their diet, no one's looked at their stress levels, mindfulness, no one's looked at anything like that. So I guess looking at it now, no, it is definitely multifactorial, definitely. But I'm talking a lot on this point because I think it's so important, but any pain, any symptom, like it was back then, is a godsend. It's an opportunity. So my
yeah.
pain, even though I was suffering through it, I learned so much. And look, mate, honestly, no exaggeration. In South America, I've changed tens of thousands of lives simply because I suffered that pain. And that'd
Mm.
be the case with a lot of people. You've had mercury toxicity as well. We'll probably talk about that with me. But, just one or two people that we can help after our journeys when we're on the other side of it already changes the course of their life.
Yeah, it's a powerful thing, isn't it? Once you've gone on that journey and you've learnt those lessons, we've got a wealth of knowledge to share. And I do want to tap into all of that. But I would like to focus in on back pain a little bit because I think it's a common thing a lot of men in midlife are feeling. And if they've had it for a long time or if it's just starting to rear its head now. And you touched on, obviously nutrition and lifestyle and stress. And I want to get to that too. But can you lead us down your journey with your back pain and what happened to you?
Mate, me, like a lot of people, ignored it. I ignored it from a young age because the younger you are when you feel it, you just think it's normal. I associate it with running, with playing rugby league and surfing, let's say. And then I'd go to sleep, wake up, no pain, start again. So as a kid, you just associate that. However, it's not just as a kid. I deal with this and I've dealt with it for more than 30 years. It doesn't matter whether it's an elite athlete or a tradie. I treat heaps of tradies or anybody. Unless someone has taught them otherwise, it's very difficult for most people to go, hang on, the pain is actually my body trying to advise me that there's an underlying problem. Yeah. So that was my journey. The journey took me to chiropractic. I actually treated it like a pain, like a painkiller, and I'd be fine for a bit, and then the pain would come back again. So that was a little bit challenging at the start of my career, thinking, well, am I studying the right thing here? But it was really only with time that I realized, no, you got to go deeper. You got to train correctly. A lot of people, mate, a lot of men in their 40s and 50s train the same way they did when they're 20. Number one. Number two, they don't alter a thing. Like if you're feeling pain and you've got a chronic problem, well, there's instability in the joint. And if you go and try and strengthen an unstable joint, you're just going to perpetuate the problem. So a lot of us do that as well. That's another reason. Another really common reason is dehydration. Very few people tell us when we're kids to go and drink water, so having really dark urine could be normal for a lot of people because no one's told them otherwise, but all of these things contribute to that. So I went through all of that. I also thought that I could train off a bad diet. So in South America, in Sao Paulo, Brazil, I was working 10 hours a day, and I'd finish and I couldn't be bothered cooking, and I went straight to have a pizza. Like that'd be 4 nights a week. So then my second struggle came, and that was the mercury toxicity. And I learned a lot more about that then through functional medicine. So, look, that around that time, I ended up having spinal surgery. So a lot of people they don't understand that they don't have to choose between allopathic medicine or alternate or complementary medicine. Many times, depending on the problem, you've got to combine both. Okay. And if I realized this earlier, it would have been a lot different. That when we're in pain, when we have crises, and that reflex from our brain is calling our attention to a problem, if it's bad enough, it's like a house fire. You need to call the fire brigade. They're the only ones that know how to put a fire out. Yeah. However, in our society, we're expecting the fire brigade to help us rebuild the house. It's not the doctors, it's society looking to a health profession, and that in reality, it'd be better if it was called a disease profession, okay, or a pathology profession, but to a health profession, and like, well, what do I do now? So people are left with the underlying cause, yeah? And that's probably where, if we realize that we need to look for the carpenter, the electrician, the plumber, and all of that to do what we've got to do to avoid that fire coming back, I guess we'd learn from crises. So, mate, the crisis thing was important because I had various crises along on my journey that led to spinal surgery. Yeah. And that was 15 years ago, 40 years of age. So I'm 55 now. But what I can tell you is I'm better than ever. And for anyone listening, if I only take one thing away from this today, believe with the right work, putting everything into place, you can be better and feel better, function better than ever.
I'd like to rewind on what you just said, and just out of curiosity, what do you think you could have done that might have prevented the spinal surgery?
What could I have done? Okay, quite a few things. I could have eaten better. I could have recognized that that's important. Our inflammatory load is important, and that's exacerbated by poor diet, alcohol, and more. Okay. Secondly, listen to my body. And in my case, I could deal with pain pretty well because I had it from when I was a kid. But let's imagine you got two people. One's feeling a lot of hunger and the other one's feeling a little bit of hunger, but they both need to eat. The one who's not feeling much hunger could leave it longer, right? It's a similar thing. It's a reflex. So just learning earlier that any sign that your body gives you, you've got to give it attention and go to the root cause. And then, mate, what I would have done then is I would have learned that what we didn't learn from university, that you've got to share the load. I've worked the same side of the table my whole life. I do every adjustment on the left side of the patient. So you can imagine me doing 50 side bends a day for 20 years. It's no mystery as to why the degeneration occurred on the left side, and I got left-sided sciatica.
Yeah.
So I guess there'd be a lot that I would have learned, but that'd be the main things that I'd tell you right now. And to know who to go to. You've got to know who to go to. A lot of people don't recognize the necessity to include multiple people, multiple professionals in their health group.
Mm. I like what you say there. I think it can be quite challenging in this day and age. And like coming from a personal training background, like there are some amazing personal trainers in the gym who have got the incredible skills and incredible knowledge to help people with pain. But then there's a whole heap of terrible personal trainers in there that you just wouldn't want anyone to train with. And to the general pop stepping into a gym like that, they're just like, well, how do I know who's a good personal trainer and who's a bad personal trainer? And there's probably the same in the chiropractic world and in the health industry. What advice could you give people when they're looking for health professionals, do you think?
Work with someone who understands function. Yeah. Understands function. If anything hurts, listen to your body. It's trying to tell you not to do it that way. And ironically, some people do it for decades incorrectly. Yeah. What else? If it was like a personal trainer, I totally understand what you're saying there. So the quicker we understand if someone is more of that allopathic nature, that I mentioned before, as far as putting a fire out, maybe looking just at the aesthetics as opposed to function, the better. Yeah.
Yeah.
And look at our goals. That's another thing I tell everyone. Like, what are your exercise goals? If you're not questioning why you're doing something, and like for us men over 40, we'd have to include right up the top of the list an increase in testosterone and growth hormone naturally through our exercise. Yeah. And so most of us are flogging ourselves for too long. Cortisol is left way too high for way too long, and therefore it suppresses testosterone. And then you lose a lot of the benefits you actually want from exercise.
Yeah, I couldn't agree more,
So
mate.
yeah. And I guess one more would be working with a personal trainer who works with other people. They don't try to profess that they know everything. Like, no, you need to work with this nutritionist. You get all sorts of reports from your clients that you deal with in regards to the advice they've got from personal trainers. I mean, I've had my patients, some of them tell me that some of their personal trainers adjust them. And you're like, adjust them? What do you mean? Oh, yeah, he puts me over the thing and cracks me. You're like, that's actually illegal in England, where chiropractors got the actual active chiropractic protected. So anyway,
Yeah,
bit of common sense.
learning to stay within your lane, mate. That's the big part of it, isn't it? And
That's
being
exactly right.
being able to refer out when it's obviously beyond your skill set is a good thing to pay attention to. I'd like to touch on training a
one
little.
more thing. Working with someone who actually can say, "I don't know," I don't
Yeah.
know. Hey, this one's saying that. How can that can change the course of somebody's life? Yeah.
Yeah, that's it. We don't need to know it all, mate. Exactly.
No.
I'd like to touch on training, but before we do, let's just rewind a little bit to the nutrition side of things, because I think there's a big disconnect between pain that we feel, the physical pain that we feel, and the food that we eat. Like a lot of people don't understand that, hey, this diet that I'm eating, this inflammation that I'm getting from the food I'm eating could be causing, let's say, back pain. Can you talk to us a little bit, your experience there, and something that might, I suppose, be a bit insightful for the listeners who just don't yet join those dots?
Yeah, sure. And as I said, I learned through personal experience. I also learned working in a big city, which is Sao Paulo, of 20 million people, where people dedicate to work and don't prioritize their health. So most people feel that if they were hungry and they've given their body something and it suppressed the appetite, it's doing its job. Yeah. They don't recognize that everything we say, do, think has to be, is either a nutrient or a toxin. And health is not based on how we feel, it's based on how we function. And we can only function anywhere close to 100% if we're getting a sufficiency of nutrients and a minimum or zero of toxins. So if you're looking at food that's not nutritious, well, it's a toxin. And therefore, you've got no chance of functioning anywhere near 100%. So when you can do this and you can recognize that a lot of these foods that are toxins are inflammatory, whether it's because they contain high levels of omega-6 fatty acids, for example, seed oils, fried food, all the rest, whether it's alcohol that ruins our gut biome totally, so most of our immunity and our well-being our serotonin comes from our gut, okay? And also inflammatory foods increase the permeability in the gut lining, and obviously contribute to a leaky gut. So you end up getting particles in your bloodstream that the body mounts an immune defense to, which is part of the inflammatory process. So there's all of these reasons why we shouldn't eat garbage, especially if we're exercising, especially if we're at this stage of life and we want to perform, we want clarity. So what I'd say, it's a really easy thing for people to do. Sit down, get a piece of blank paper, put a line down the middle, toxins one side, nutrients the other, and ask yourself, what toxins in my diet am I aware of that I'm exposed to? Alcohol, sugar, seed oils, okay? If you're allergic to dairy, that's got to be there. Gluten for some people, all right? There's your list starting there. Let's keep on with the toxins. What emotional toxins? Stress, burning the candle, poorly resolved emotional problems, where let's say there's a marriage breakup. Like I've had a mate who's been through one. He was a pain in the bum for years. He just wouldn't let it go. And it was so frustrating watching him worsen his health in every sense because he just wouldn't go to the root cause and deal with it. And then lastly, how are you moving? Are you moving enough, or are you moving correctly? Like, for example, sedentary lifestyle is a big challenge for a lot of people. Or tradies, for example, that have worked their whole lives are carrying these biomechanical joint problems and they're not dealing with them. So they'll go to work, they'll labor through the pain. So we've got to look at how we're moving, and that's so important. So they're the toxins. The nutrients, back to the diet. Are you getting enough veggies? Are you getting enough vitamins? Good fatty acids? Are you getting the right amount of proteins in order to get the amino acids to repair the muscles? Are you drinking good quality water? Water's everything. I'm running a 3-day water fast every month, and there's 150 people on the group now, and I invite anyone who's listening to join too. Mate, we're listening to miracles. But honestly, the body is a miracle, and when it's left away from food for 3 days with good quality water, you get everything from psoriasis, clearing up, joint pains, all sorts of stuff. It's not a treatment. It doesn't treat a thing. It just lets the body do what the body does well, and that's heal. Problem is, when we're eating too much, or we're not giving our body that window of time without food to focus on other things, because digestion is energetically very heavy, takes a lot of energy, then the body doesn't get a chance to heal. So I'd say, I mentioned a lot there, but I'd say that if people follow those rules and they go, okay, I'm getting good quality sleep, emotionally I'm fine, or if I wasn't, I'm doing my meditation, I'm doing my breath work, doing whatever, time in a sauna. And then lastly, I'm moving well, I'm doing exercise every day, but I'm not smashing myself. Your body will do the rest.
Yeah, nice one, mate. I love what you said there and how you focused in on nutrient density, because I think we've been blinded by calories in and calories out and counting macros, and I'm not a fan at all. And I really think that when we say, oh, it fits my macros, it's like, well, okay, that might be so, but what is the nutrient density of that food that we are eating? And yeah, okay, you can lose weight by cutting calories, but that doesn't make you healthier. Just because you've lost weight doesn't actually improve your health status. And if we're not getting in the nutrients that our body needs, and you touched on it, to make our hormones, to grow new tissue, to support our muscle, which is, our metabolism and everything there, well, then our body's going backwards, not forwards.
Totally.
And yeah, so with all my clients, I don't focus on calories in and calories out. I'm just going to focus on, like, right, what are you eating? Like, let's cut out all the ultra processed crap. Let's get in good sources of protein. Let's get in fruits and vegetables. Hydration is huge. Salt is huge.
Yeah.
So many people are not putting enough salt on their food and getting enough electrolytes.
Yeah.
All that
It's
stuff.
not rocket science, is it, mate?
No, it's just simple stuff, mate. We go back to what our ancestors would have eaten, and just eating more of it and taking care of ourselves. We don't even need to think about the calories that we're consuming. And again, like you said, it comes back to how good are you feeling? Like if you eat the right food, you're going to be feeling so much more energetic, sleep better, recover better, and just perform at your best. So I can strongly support everything you said there. I was worried you might go off on a tangent, but you didn't. So
Just one
we're on
on
the
weight
same
loss.
page.
I wish I realized this earlier. Yeah. On the weight loss thing, that some people feel that if they stop running, they'll put on weight. But
Mm,
they're the same people who've been running and pushing themselves their whole life and never lost weight running. But they just feel that they'll put it on if they stop. Now, we've got to understand that when we get to that point in exercise where we are putting ourselves into a stressful state, and there's no magic number because it depends on age and a lot of other things, how you work, is it physical, is it sedentary, whatever. When cortisol is elevated for long enough, it will it'll upregulate the deposition of fat. It wants to store energy. Your body thinks you're fighting a dinosaur for survival or running from a tribe or something. So it stores fat. And this is incredible. This is such a game change for a lot of people. Eat well and go and walk. Walking
yeah.
is a legit exercise. I learned that firsthand after spinal surgery, where I was walking 6 hours a day. And I'm seeing it. And like people like Mark Sisson, if
Mm,
people are familiar with him, look him up. He was the Daily Apple. He had that
yeah.
his
Yeah.
little blog for a while. But Mark's just released a book about walking. He was an incredibly elite marathon runner. And now he's looking at walking, going, hey, you know what? I
Yeah.
wish I walked. That it can be very detrimental keeping your stress levels high. And as I said, when we talk about weight loss, really consider that. That's a game changer.
Yeah, I agree, mate. I used to own, for many years, I owned a CrossFit gym, and it grated me with the intensity. It was just like, these people are living in a big city, they're stressed, they're not eating well, and now we're smashing them in the gym with high intensity training week in, week out. Most of them just need to do less and actually slow down. But the endorphins, and they think it's great for them, and they keep going with this high intensity training. But in the long run, it's having detrimental effects on its health, on their health again. Yeah, some people can tolerate it, but most people can't. And I was one of those. I used to run marathons and do triathlons,
Yeah.
um,
Yeah. Me too. Me
and
too.
that destroyed my gut. That led me
Yeah.
to leaky
Yeah.
gut. That led me to functional medicine. That led me to having to heal my gut. And a big part of that healing process was actually changing my training, like actually backing off on so much
Oh,
to actually
Gordon.
allow my body to recover because of the volume of training and the stress I was putting on myself with just constantly pounding the pavement.
Because
So yeah, I agree.
cortisol, when you're fighting for your life, cortisol is anti-inflammatory. It'll go up, it'll come down. It's anti-inflammatory, but when it's
Mm,
elevated for prolonged period, like for prolonged periods of time, it
yeah.
turns pro-inflammatory. So this is
Mm,
why a lot of runners have terrible gut problems as well, because it's actually inflaming their gut.
mm,
There's
yeah.
stories of marathon runners having serious intestinal problems during a race.
Mm,
So, mate, I've been through the same journey. I used to run, and if I could turn back time, I wouldn't have. I would have sprinted. And
yeah.
there's a really good reason you look at a sprinter and you compare it to a marathon runner. If it's dose related, it's the marathon runner who deserves the sprinter's body, right? You know what I mean? But the sprinter gets that body because they're actually stimulating fast twitch fibers. And it's
Yeah.
the fast twitch fibers that increase growth hormone. So, and plus they're not jacking their cortisol through the roof.
Yeah, yeah, exactly. It's like the high intensity for very short periods of time, allowing them to, target that fast twitch fiber, which has got the best potential for hypertrophy. How's your training looking these days? What are you doing yourself?
Mate, training for me these days is definitely walking like 4 or 5 times a week, especially when the sun's out. Like I get that and grounding. So I walk bare feet, get sun on my body, and then I'll do probably 2 functional workouts a week with weights a little longer. Okay. I've got to go back to sprinting. I had a bit of a hip injury, but I was doing sprints twice a week. But that was like 30-second sprints. That's it, done. And interestingly, my girlfriend does Tracy Anderson, and Tracy Anderson used to work with Madonna. And I thought, oh, I'll just do it with her just to, give it a go. Wow, it's legit. Like it's legit combo of, let's say, Pilates with functional. And I'm noticing for me at this stage with low back health and hip health,
Yeah.
plus it's cardiovascular, wow, big differences. So I, I think what we're going to do, mate, is look at our work too. There's days I'm 8 hours physically active with my clients. And I was pushing myself by training too hard in the morning. And then I was waking up at 2 a.m. going, what am I doing? Like, what's waking me up? My cortisol's through the roof. I'm like, no, not me, not functional medicine, Jace. So what's going on here? It was just common sense, mate. As soon as I decided not to push myself on those days that I'm physically active,
Yeah.
happy days.
Yeah.
So
Yeah.
I think we've got to look at our life and we've got to allow for flexibility. If we wake up, for anyone measuring their health, getting their metrics around that, if they're waking up and they know they haven't had a good sleep, don't do the high intensity workout. If you do for a shorter period of time that day, and go for a walk. On the day you're waking up great, go and smash it out. But as we get older, high intensity, shorter duration for sure. Oh, there's another thing I love doing. And I've done this for 20 years. Twice a week, I'm doing my weights with a power plate. So I'll go and do push-ups on the power plate, and then I'll press do squats. Then I'll go back to the power plate, I'll do abs and go back and forth like that. I do a whole body workout on the power plate because it vibrates at a high frequency that stimulates the type 2 fast twitch muscle fibers.
Okay, I'm not going to jump on board with the power play, but I take your
Well, mate, what I'd say, I get it too, because when I was overseas, we were working with athletes and all sorts of people, and back here you'd see it on info commercials. So a lot of people, I guess, bought really crappy whole body vibration. But what I'd say, go on to Google Academic, Google Scholar, and put in whole body vibration, ACL recovery, growth hormone, and there's so much research around it, but it has to be good equipment vibrating in 3 planes. And none of this is an alternative to just weights. But I do feel that if we're not including stuff for fast twitch fibers, we're only really stimulating a certain portion of our muscle fibers and not the type 2 fast twitch.
Yeah, okay. I'd like to add something to that, and I'll plant a seed that maybe something you can look into, because I hear a lot of people talking about power training and being explosive, and we want to train that because that is more fast twitch. So we talk about a lot of plyometric exercises, and you'll see a lot of health professionals, talking about, it's all about power. And they'll go plyometrics and Olympic lifting and all these things. And I get it. That's awesome. They're great things. But I would actually argue that plyometrics and Olympic lifting are about rate of force production. So it's like how quickly you can go from 0 to 100. Okay. So it's like, imagine it's the Ferrari. And so you put your foot down in the Ferrari, it goes from 0 to 120 in, let's say, 3 seconds or whatever it is. But then you imagine the Mack truck, like the big truck that pulls the road train.
Yeah.
It's not going to go from 0 to 100 in 3 seconds. But the engine in the Mack truck's got way more power than the engine in the Ferrari.
Mate, I'm with you. Yeah.
It's going to tow a lot more weight.
Yeah.
So one of the best ways to stimulate fast twitch muscle fibers is actually by doing very slow eccentric movement under heavy weight.
Mate, I love that idea. Yeah.
We target that, and also it teaches us to move better because we're moving really slow and we're lifting heavy weights, which is good for muscle development. But then we activate the muscle motor units and the muscle fibers, and then we can go and lift a lighter weight and stimulate them more. So some of the best training we can do to hit those fast twitch muscle fibers is actually lift heavy and slow and not worry too much about the high intensity or the plyometrics or Olympic lifting, which is rate of force production.
Yeah.
But also I think as we move faster, and you'll probably agree with me, the potential for injury increases dramatically.
Definitely. Yeah. Especially if we're not sure how prepared we are, if we've warmed up sufficiently or not. But mate, when I was in Hawaii, I was working out with a good mate of mine, Jesse Salas. He does foundation training. Mate, we had loads that we weren't moving. So there's a chain on something on the ground. We put like biceps or under a shoulder press or a squat. And there was no movement. It had to be full force, 20 seconds. Unbelievable.
Sounds like you got your training in check, mate.
And mate, look, I can't take credit for that. That one came from a good friend of mine who does foundation. And he also put me onto Katsu. I don't know whether you've heard of the Katsu blood flow restriction bands.
Oh, yeah.
We do that in conjunction just to augment the results as well.
Yeah, awesome. Do you want to explain that just for the listeners who don't know what Katsu is?
Yeah, so you can do blood flow restriction bands, which are quite simple bands around the top of let's say your bicep, and as high up on your leg, close to your groin as possible. And what happens is with that decrease in blood flow, perceived blood flow by the brain, it upregulates a lot of functions. For example, nitric oxide, growth hormone. And in reality, for a lot of people who don't want to put too much effort into a workout, they actually get the same benefit in so many aspects using the bands. Like, for example, you can go for a walk, or I started working with them. So you're just putting a little bit of load on your heart and your body, your cardiovascular system, a good load, while you're doing something quite mild.
Yeah. Excellent, mate. I think that they've come a little bit more trendy in the last few years with everyone using that sort of blood flow restriction.
Yeah.
In gym, outside the gym, all that sort of stuff. So,
And the Katsu one that I have is actually a mechanical one.
yeah,
So it pulses. So you feel these bands actually go in and out of a contraction around your arm.
interesting. So it's like it's doing like a circulation cutoff, and then it's opening it up again, and then it's going closed. And open.
Exactly.
Interesting.
I said contraction, so I meant to say constriction. Yeah.
Yeah, I getcha. Well, we're on the topic of this. A question I'd like to ask you is like, what's your philosophy around training with pain?
Don't do it.
Not to
Modify.
not to any level. Like, I think, would you say, like, a scale of 1 to 10, where 10 is like, obviously I'm in a shitload of pain, to 0, I'm not feeling it all. If someone's just feeling like light pain through a movement, but it's not, over 5 out of 10.
Yeah.
Where are you putting yourself on the pain scale here?
Okay. So we got to divide me into two people here, the practitioner and then the person who does it. So the practitioner, because I'm not there in the gym and I'm not seeing this, the safest thing for me to say is don't do it until you're out of pain. Because then we've got a baseline, and then you can start to introduce these things and know if they're responsible for the pain you're feeling or not. Okay. Now, the normal me, training person, me who's not the practitioner, would say that I've learned a lot recently where I have had pain. Let's say I've duck dived a big wave and I've just been shaken around and I've, sort of had a muscle strain, or let's say, I don't know, maybe worked out quite hard and could feel pain. I'm actually with a bit of bursitis at the moment, the shoulders from work. What I've noticed is that if I'm using lighter weights, like ridiculously lighter weights, let's say instead of 10 kilo lateral raises for your shoulder, they'd be 1 or 2 kilos. But going through movements that you're restricted in and working that, like for me, for example, I've been restricted in backstroke movements because all of my anterior muscles, like my pecs, anterior delts and everything, has just been ridiculously not only contracted over the years, but biomechanically it's changed my shoulder a little bit. And work, I'm bent over a table, bent over people working. Wow, I've noticed so much by hanging and doing backstroke motion with the weight. So yeah, I'm still training, but I'm modifying the training. Now, sometimes that's hard advice to give to someone to use their own discretion in what to do.
Yeah, I agree. I still think movement is life. And, we talked about circulation there, and that's what brought it to mind. It's like, well, if we're keeping a joint dead still and it's not moving, like the healing process is probably going to slow down
100%.
because of that. So it's like,
yeah, I'm aligned with you big time on that one. And so many times, let's say, a good example, recently one of my clients fractured a rib surfing in Fiji. We've had him swimming. He can't have that direct pressure on the board. It has hurt a little bit, but movement heals. Yeah. So you've got to find what type of movement. And for many people, it's walking, or swimming, or getting in a pool, depending on their injury, and just walking in waist-deep water to get the actual movement there. Because one thing that we've got to remember is that movement stimulates the cerebellum. Cerebellum is the movement center of the body, the brain, but it's also the homeostatic center of the brain. We've only realized this in the last 20 years, that homeostatic center actually influences so many other functions, neurological functions, from sleep to digestion to so much more. And that's through movement. So you can imagine if we leave a joint without movement, that is actually really dangerous for our health.
Yeah, exactly. I agree with you there. And I think, sometimes we can have that injury or that existing pain we've had for years and we want to avoid it, but sometimes we have to move towards it sometimes to make the healing process happen.
Yeah, definitely.
So Usually with my clients, I'm like, if it's under a 5 out of 10, keep going or lighten the weight a little bit. But if it's over a 5 out of 10, we should probably stop and let's find another movement that's not going to cause so much
Yeah,
pain.
that's it. And
So
if you do it and it worsens, okay, listen to your body. Like
yeah. And the other
dance
thing is
around
like,
it.
you might feel pain during the set. I'm like, okay, if that's something we want to be careful of. Does the pain linger after the set? And how is the pain 24, 48 hours after the training as well? So the more information we have, the better the judgment we can make about, okay, is that the right movement or not the right movement? Do we need to modify things?
Yeah.
Mate, we've touched on training a fair bit. Let's change gears a bit because I know you've suffered with mercury toxicity. Do you want to talk to us a little bit about that?
Okay, mercury toxicity, I'd say that started in the health food store, reading about the effects of mercury fillings on our health. So I was always aware that, hey, this might be something nice to look at one day. One of my big problems in life around my health is being impulsive. And I was living in Brazil. I've come home and just got my local dentist to rip my fillings out. And you have to follow a full procedure that includes, a vacuum, a dental dam, oxygen, a chelation before and after, all the rest with chelation as binders. So
Yeah.
none of that was followed. And then I didn't notice, I didn't make that relationship. I should say he just drilled into my feelings, drilled into them.
Fun.
So obviously gas has gone everywhere. Mercury's not stable in any form, but gee, as a gas, it'll go everywhere and just, affect some other tissue. So I didn't connect the dots when I don't know how many months later I had chronic gastrointestinal problems, which I'd had most of my life to a certain degree, but so I didn't really correlate one to the other there. I I could get by. I have to show up every day for at least 50 people in my clinics. So I could get by, but I was tired but couldn't sleep. Or over in Brazil, I presented a program on live television for years, and I was always on telly over there promoting spinal health and women's programs and all that sort of stuff. But I was forgetting what I was saying halfway through a phrase on live television, going, "Hey, this isn't me. I know something's wrong." But so then the anguish started because, I followed typical allopathic tests, and most doctors don't recognize that mercury has the effect on our health that it does. And so because of that, within medicine, there's not many ways you can test for it. And that was quite shocking when I was going down this path. And I was guided by, luckily, one of my patients in Brazil was the founder of functional medicine in Brazil, Dr. Gilbert. So if it wasn't for him, I reckon I'd be fast tracked now to some sort of severe neurological disorder for sure. So we got on to, you know what? This is interesting, a parallel story that I had a bet with my best friend over there. She wanted me to donate my sperm to her. And she's like, oh, how do you know you got good quality sperm? I was like, I'm healthy. Anyway, had a little bet and I went and did a spermogram and it was low as. Like it was probably, the doctor said he wouldn't get anyone pregnant ever. And so why I'm mentioning that is that sometimes we get a jigsaw puzzle. And that's so random. Like, where would you start from there and how would you get it back to mercury? But that's exactly what happened. Low testosterone, high FSH, follicle stimulating hormone, MRI of the pineal gland, all good, and pituitary, all good. Like, I just had to work backwards. And then, didn't get that far, but got to far enough to know that something was wrong with my testosterone. It was way low. And then came home and luckily a woman in our health food store, a client, had the same problem with her son. And my mum said, after seeing me exhaust all my potential blood tests and everything, she said, go and test your mercury. And it was off the charts. Mate, I'm not sure how much yours was, but tolerable is 0 to 6. I was 600,
Wow.
600 off the charts. And then,
Yeah.
look, the doctor I was dealing with hadn't treated many because they don't look for it. But a guy before me was 250 and he'd painted the Harbour Bridge for 20 years.
Wow. Yeah, that's it. Mine wasn't any mercury fillings, and I couldn't really put my finger on it. The only thing I could put it down to was seafood. Like maybe I stored the mercury from seafood because of our fish is high in mercury. But I do what pointed me in the direction, like I was experiencing similar sort of stuff to you. Low libido, always tired, always thinking, couldn't switch off, couldn't sleep, couldn't recover from training, so it was all backing all that off. And then I did a genetics test. I was looking at my genes and I came back with MTHFR gene.
Yeah.
or the
Yeah. Yeah.
motherfucker gene, which
Yeah.
affects detoxification pathways. And off the back of that,
Exactly.
the functional medicine doctor goes, we should probably just test your heavy metals just in case. And I think mine came back at around 400 and something, my mercury as well. But within 6 weeks of doing infrared sauna, like 3 or 4 times a week, and some binders and stuff like that, my mercury just really came down
That's
really
so good.
quickly.
Yeah.
So, yeah.
And that's the other thing I was going to say is that so many people have been exposed to the same amount of mercury we have and heavy metals, but
Mm,
their detox pathways are efficient more than a lot. I didn't have that, don't have that gene. I've done that test,
yeah.
the SNPs test, but yeah, these people have the ability to pass it out of their body. I wouldn't say that that should give you like the tranquility in eating lots of tuna because I have been to the
No.
Maldives on a 3-week surf trip
Yeah.
and like it went through the roof. It
Yeah.
went through the roof.
Yeah, that's exactly right, mate. I think you can start to learn a little bit, don't you, about obviously
So
certain foods, how certain foods affect you,
yeah,
and certain things you need to avoid. And yeah, tin tuna is one of them if you're really bad at detoxifying mercury. So, yeah.
I should have said it went through the roof, mate, because I was eating tuna every day.
So was that mercury toxicity your first experience of like a functional medicine doctor or working in that, or what sparked that interest for you initially?
Mate, with the health food store, as a
Yeah.
kid, I was always around like naturopaths and people who worked in the area. So I would say that combined with chiropractic, when I go to the States at the expos with the chiropractic conferences, a lot of these functional medicine companies or functional companies would launch products to the chiropractors first while they were waiting for their products to get FDA approval. Yeah. And so we were exposed and still are to a lot of things. It'll take 5 or 10 years to come out. I remember like the cryotherapy boom. That was years ago, or PEMF. A PMF I saw 20 years at a conference, but it took, I noticed probably 10 years ago. So that was something that luckily, bit by bit, I was around. I followed Joe
Yep.
McCullough for a long
Yes.
time. And I'd say McCullough combined with my Brazilian client who ended up inviting me to study functional medicine with the doctors that he taught. That's how I just built on that from, bit by bit. And it sounds funny, but a really basic, I guess, treatment approach is the Gerson therapy. And that's been around forever. But that basically is that premise of getting toxins out as fast as you can and getting nutrients in there as fast as you can. And that's what I applied to myself, and I still do. I applied to myself in regards to the mercury toxicity because different to you, mate. I tried everything and it wouldn't. It would come down temporarily and go back up again. I
Yep.
tried DMPS, EDTA, all the binders, bought a sauna, and it, definitely beneficial. But
Mm.
I compare this process to like our liver is like a big sponge that's dirty, that's washed 200 cars. And let's imagine we wanted to clean that sponge and get all of the dirt out of it. We only had the ability to just do one little squeeze a day. That's sort of what a detox process for the liver's like for most people. Yeah. So the sauna is great, good quality water is great, more water, sweating during exercise, movement, lymphatic drainage, binders. But it was good, but not good enough. So I applied the Gerson therapy to myself and I had to, sign up for coffee enemas. Now, I didn't do the 4 a day like they do with late stage cancer patients, but yeah, I did it every day. And
Mm.
that's when I saw my mercury levels come down to levels that were, less normal levels, 0 to 6 or zero.
Yeah. Yeah.
And that's
And
something I've stuck to.
okay, so is that something you still do now, or is that you can back off a
Still
fair
do it
bit?
now, mate. I still, you know
Yeah.
why I still do it now? Because this is my theory. Some people might not agree with it, but I also do live blood analysis. So I'm working a lot with toxins
Mm.
and working a lot with healthy people that practice healthy practices, but not many are focusing on detox as well as the introduction of supplements and good diet. It's not enough just to focus on putting nutrients in. Most of us have to think about getting them out, and we have to look at our toxic load and see what we're exposed to. So there's
Mm.
a lot of tradies, I see actual particles in tradies' blood because they're getting fibers on job sites or surfboard shapers with fiberglass in their blood, Hey, you've got to be looking at that regularly. And I'd prefer, I don't know about you, but I was in that bad a spot that I'd never want to be back there again. And I'll do whatever I've got to do to not get there. So the saunas and the enemas and all of that is a part of my routine now.
Yeah, I totally get it, mate. It was hell for the time that I was there. Just the lack of sleep and not being able to sleep, and like my sleep these days is just it's my sacred zone. Nothing interrupts me because I just need going through that. I'm just like I need my sleep. So I could definitely right. Through your experience with functional medicine and all the stuff you do, you've touched on mercury. Is there anything else in your journey that you've come across in your own health since you've got more involved with that side of the thing, that side of medicine, I suppose?
Yeah, mate. There's so many things, so many things. But before I mention my big and exciting, most recent modality, I would just say it does really come back to the basics. Good food, good water, good movement, good sleep, good relationships, all the basics. And everyone's got access to that. But if we look at the importance of oxygen, then hyperbaric therapy has helped me. And it helped me way back when I had mercury toxicity. And it helped my mum, who had late stage lung cancer from smoking 60 years and who couldn't do chemo. So I had to get her back to Brazil. Okay. When I said couldn't do chemo, they said, look, you're too advanced. We don't want to do chemo because it's all about quality of life. So I had her on a plane back to Brazil within a week. And that's where we sat down and customized her, let's say, treatment with the doctors I learned the functional medicine with over there. We use the mild hyperbaric oxygen therapy as well. And so recently, I've purchased one of these. It's a 2-atmosphere heart chamber from Cell Regen. And oh my God, like on my own health and my clients' health that I offer to them, I don't advertise I have it, but I'm learning firsthand. It seems like a miracle. No, the body's the miracle. It's just that so many of our injuries and pathologies and challenges involve a deprivation of oxygen to certain tissues, which is called hypoxia. So when we can come in and hack how we get oxygen into the body, we see the body do its job. Yeah. And so I'll explain how it works. Like when we breathe, we rely on red blood cells to carry oxygen all around the body. We breathe it in. The 21% oxygen in air is exchanged for CO2 in the lung. Away it goes, right? Now, if we rely on those red blood cells and they're already, for most of us, 96 to 99% saturated, we can't really hack oxygen that much. If a tissue needs it, let's say a tissue that is necrotic, that has a tumor growing, they love glucose as fuel. They hate oxygen, but we need to get that oxygen there, which is my mum's case. We need to get it there. What do? So we hacked it knowing that the pressure in the chamber actually puts oxygen into the plasma. So we're bypassing our oxygen transport mechanism, getting oxygen under pressure into the plasma, and 4 times oxygen than air. So it's 80 to 95% oxygen going through a mask. And that means we can get up to 30 times oxygen to the brain. So think about that, how that can impact someone's life who has dementia, Alzheimer's, Parkinson's, has a sporting injury. I've got a person in the chamber right now who's just done PRP on his knee. There's a lot of mold around this area. Mold hates oxygen. One of my best friends that I've worked with for years told me he had bowel cancer the day after I got it. He's done 60 sessions and done a whole lot of other stuff. The tumor size is reduced by 40%. Is it a treatment? No, it's not a treatment. We can't confuse this. We're giving the body what it needs in a high concentration. And if that is one of the causes of their pathology, then we may see incredible things happen with the body. But we come back to that premise. Give your body what it needs, keep it away from what it can't have, or get what it can't have out of your body. Let it do the job,
Yeah, awesome. I like how you put the foundations there first, like getting all the basics right before we start throwing, other things at it. But the hyper oxygen chamber, is that what you call it? Or
yeah, the mild hyperbaric oxygen therapy. Yeah, so
oxygen therapy.
Mate, till recently, that was always a hospital thing, or for divers when they had the bends. And they were chambers that went to, between 2.5 and 4 atmospheres with 100% oxygen. So only hospitals had enough oxygen to be able to put that oxygen into the chamber. Now, oxygen's volatile. So there's a bit of a misconception or misunderstanding around a danger involved with mild hyperbaric therapy, which is very different to hyperbaric therapy in hospitals. With the mild, oxygen is delivered via a mask. So you don't have high levels of oxygen in the chamber. You breathe it directly in through the mask, and the pressure only goes to 2 atmospheres, which is the equivalent of being 30 feet underwater. Yeah. Now, if
Yep.
you follow a few basic things like being able to equalize and avoid, for example, anyone with a perforated eardrum, with emphysema, any challenges around equalizing, happy days. It's as I said, I'm seeing incredible things. And another thing for anyone who's exercising, recovery, incredible, and doing it before sport and exercise, next level energy.
Interesting. I'll have to drop in and give it a shot someday, mate.
Yeah, I'm sure you'll love it. Someone like yourself would really appreciate it.
What's the practice? So, like, what? How many times a week are you doing? How long are you in the mask for? What does it look like?
Mate, the protocols vary person to person. I'm in there
Brilliant.
3 to 4 times a week. Often when I wake up at 5:30, so I do that before I do my detox and before I do my training. I can also hack it. I have NAD before it. I have other supplements like spermidine. What else do I have before it? All my probiotics before it, so it augments the I guess their uptake in the body. But I also do it at nighttime. You know, if I've had a big day and I want to recover, I just do it just before bed. And I can hack that as well by having rhodiola, which is putting a cap on cortisol, or apigenin, which is the active component in chamomile. And wow, gee, you have an amazing sleep. Next level sleep. Yeah. Yeah.
So how long have you been doing that sort of practice for now?
I've been doing this for 6 months.
Okay. And what have you noticed over that period of time, do you think?
Yeah. And so I'm someone who probably would be the person you'd least notice a difference, because I'd like to think everyone was in line with my health and I'm onto it. Or some people say a little bit paranoid, paranoid or too dedicated. But what I've noticed is that my clarity is improved, my focus is improved, my sleep quality has improved. I feel happier. I'm thankfully a happy person, but it's just next level happiness. And I think it's due to those other things we're talking about. There's just little things, mate. There'll be times where I'll walk somewhere and I'll want to run like I did when I was a kid, but I haven't done that for years. Where I've actually just been walking and go, I don't want to run. So yeah, I don't have a pathology. It's all about longevity for me and performance. But as I said, there's some stories that have come out of that chamber in a really short amount of time that have blown me away.
Yeah. Do you want to share one of those with us?
Yeah. Okay. Vicky suffered from mold toxicity, and I'd been working with her on and off for about 6 years. Got the chamber. I hadn't seen her for a while. She was pretty good. She thought she was okay. She'd left alcohol to the side, but complained of being bloated and lack of focus, brain fog. Third session, she leaves me a message in tears saying, I can't believe it. I wake up on a Sunday now. I'd wake up down for the count. Now I'm waking up clear, ready to go. Or Monday, I had a meeting till 11 p.m. because it was on a Zoom call with the States. And Tuesday morning, I got up and I, exercised at 7 a.m. That never happens. With actually the same patient, friends of hers are saying, what have you done? You look like you've done plastic surgery, because it got rid of a lot of the bloating. We've got to, it deals with inflammation really well. And like, if you go to the science, once again, we talked about this before with whole body vibration. Go to Google Academic or Google Scholar, okay, where all of the published research articles are, put in hyperbaric oxygen therapy and a condition. Okay, so what we know, there's been some amazing research that's come out of Israel recently showing that mild hyperbaric oxygen therapy is actually increasing the telomere length on the chromosome. So up till now, a lot of what people were wanting to do was hack the shortening and stop at shortening. They're actually seeing increases in size. That's pretty incredible. There's a significant increase in stem cells just after the first session. So around a week, you're getting 10 times more stem cells. And talking about hacks, There's other studies showing whole body vibration, which actually increases something called a piezoelectric effect in the cell. It's that vibration caused with the cytoplasm of the cell, with the cell wall, increases the electrical charge, getting into the chamber and increasing stem cells even more. You can combine it with red light as well. Mate, what else have we got? We've got the inflammatory markers, inflammatory cytokines, reactive oxygen species. It's a hormetic stress, so it increases enough, I guess, to stimulate beneficial processes in the body. It's honestly blowing me away what I'm learning about it.
Yeah, so it sounds like it's got a lot of benefits for longevity when we're talking about telomeres and we're talking about all those sort of things. Like, the telomere length is linked to longevity, and the longer the telomeres are, predicted your life expectancy is going to be longer as well. For those who don't know telomeres, mate, I'd just say you're passionate about health, and it's a good thing. I think you can really tell how passionate you are about, through your whole story, from working in the health food store to, recovering from back pain to working with functional medicine. You've obviously got a huge passion for that, and you love to share that with people. What are you working on now? Like yourself, what areas of your health are you focusing in on?
Mate, good question. Good question, because there's a lot. There's a lot of possible modalities, but ironically, I'm trying to bring it back to the basics. I'm trying to bring it back to, and I guess this is post-COVID because we all have a lot of time to think about our purpose. But so my life purpose, which is helping people and educating people, health and love, those three things. Keep it tight, keep it focused, not be too ambitious, question what we're doing. If we're working and pushing ourselves, what for? The basics, but if we're talking around health, it's, as I said, sun on the skin, get those eyes in contact with the sun earlier, get grounding, get moving, get breathing, good quality water. Actually, recently I bought, this will blow you away. I don't know whether you've heard of the Kangen water filter, but I'd heard of it for a long time and had a bit of an aversion because it just seemed like there was a heavy marketing thing around. A lot of people talking about it didn't know what they were talking about, and a lot of them were talking about as a filter. So anyway, I go to this retreat, and it was the first retreat I took my live blood microscope to, and 4 women's blood in a row showed me impeccable results, which meant the red blood cells are very well separated and very energetic. Yeah, there's lots of movement. And I'm thinking, wow, I'm going to have to move to this area. It must be, the charge from the earth in that area. Because basically red blood cells rely on a zeta potential, which is a negative charge that we get from the Earth's surface. And they were totally separated in charge. Anyway, asked the facilitator and she said, look, we haven't done any breath work. We haven't done any meditation. They haven't eaten, and they only just got here. But the only thing they have done is had water from that ionizer. I was like, hey, what's that ionizer? I don't know. She didn't know the name of it. I got in contact with a guy who left it there. His name's Joel, local guy, awesome masseuse. But we tested our blood that weekend, before and after, and we were blown away. Blown away. And what I can tell you is every single person's blood that I've tested before and after has shown red blood cells that have been lethargic or actually sticky, like stuck one to the other after about 2 or 3 glasses in the period of half an hour, absolutely charged, separated, and moving pretty well. So once again, we're relying on the red blood cell to carry oxygen. And if they're sort of clumped together, then it's not going to exchange that well. So that excites me, I think with health moving forward, being able to substantiate recommendations around health is a big thing, because if we do a blood test that shows a pathology, you can substantiate a treatment for a sick person, because it's out. But there's very few tests for health. So that means a lot of what we're seeing is confusing because we're getting it from people like myself or influencers online. And it gets, I get tired of posting because I'm like, I don't want to compete with that. I don't know if people can relate to that, but this day and age, if you've got something that you can use to measure health, markers, live blood microscopy, HRV, Aura Ring, all that sort of stuff, that's what's exciting me. Because then we can actually witness the effects of the implementation of our healthy practices.
Yeah, the data, mate. It's about having the data, isn't it? And something that you can reflect on to know that, okay, what you're actually doing is making a difference. And I'm a massive advocate of blood work. Like It changed
Yeah.
my life, like from where I was and me thinking I'm healthy. I'm a personal trainer. I eat pretty clean. I train pretty well. I look after my sleep. There was a whole heap of stuff I was doing all right. And I was still feeling like shit. And I was like, what the hell am I doing wrong? Why is this not working for me? But until I looked under the hood and until I started investigating, my gut health, all of my levels in terms of my vitamins and minerals, my genes, it just opened a whole world that was like, oh, and it even made me just realize like there's just no one size fits all. We're
Yeah.
working in personal training and we're telling people they need to eat this way and they need to do this and they need to do that. And it's like, oh, actually, one man's one man's food is another man's poison, and it's
Totally.
individual to our genes, and we've got to understand our genetics, so we've got to understand our own health markers so that we can make the right choices around training, around nutrition, around even like sauna and the oxygen therapy. There's probably people that's awesome for, but there's probably people that maybe that might not be good for. So being
Totally.
able to
Yeah.
step into that with proactive health instead of waiting until we're diseased or we're broken is a huge, huge thing. And I think more men need to do. And unfortunately, we're pretty shit at that because we just sit back and we go, I'll ignore that pain or I'll
Yeah, I
ignore that
know. I
symptom.
know. Mate, look, this is a strong example to anyone listening, any man especially. If we define health based on how we feel, think about how many people woke up this morning feeling great. They'd never felt bad ever, and they're dead this afternoon of a heart attack. It's a bit unfair, isn't it? That the first sign for cardiovascular problems that causes death in 50% of those first heart attack victims is that. So it's like, let's not wait for that. If there's men out there with young families or, other people depending on them, if they love what they do, we don't have to necessarily talk about death. It could be something that incapacitates them, a stroke
Mm,
or a joint problem that their body's been warning them of for years that they've either been ignoring or covering up via the use of painkillers. And none of this is bagging out medication or painkillers or anything else. No, it's not. It's actually just saying sometimes you might need to put the fire out, but also at the same time, look at rebuilding. And you don't ask advice about rebuilding to the same people that are putting out the fire. And if
yeah.
your paradigm's relied on that your whole life, well, maybe it's time to question it.
Yeah, yeah, yeah. I agree with that, mate. I don't think pharmaceuticals are the solution. They're the band-aid that might cover up the symptoms. But until we look at root cause, which is what you've talked about through our conversation today, I think we're never going to solve those problems. So we've got to switch back and think about, well, what is the root cause? Why am I feeling pain, or what's going on in my body? Yeah,
And mate, don't
yeah,
get me wrong, I've had spinal surgery. Thank God for medicine. Thank
yeah,
God for
yeah,
that. And like that was the worst pain of my life. But hey, and this once again, respect to the surgeon, he was awesome. But I was a bit disappointed there was zero support post surgery in regards to what should I do? How can
mm,
I avoid this happening again? But it's okay. It wasn't his fault. He's a responsible, very proficient professional. It's not within his paradigm to teach me to look for the cause and rectify that. So
no,
we've got to learn that.
yeah. Taking some ownership of our own health, mate. I agree with you there. Yeah,
Yeah. Yeah.
yeah,
And, I see it all the time where unfortunately someone's let their house catch fire. They've got late stage cancer, chemo, radio, and all the rest are used for them and used well, gets them out of that crisis. Then they go and rebuild. They go to the cause, they stop smoking, they fix their diet up, they get the oxygen in there. And that's when we see, I guess, the way our system should work, as opposed to a dependence on a system that'll get you out of pain and suffering when you're in pain, but not, give you autonomy and make you independent and empower you with information to look after yourself after it.
yeah. Well said. Well said. Yeah. For our listeners that are tuning in who are maybe experiencing chronic pain or burnout, where would you say is the best place to begin?
Ooh, good. Well, I'd go back to I agree with you. Get a good doctor dash naturopath dash functional medicine professional to test your functional blood panel, to go and do, your SNPs, your single nucleotide polymorphism tests, your genetic panel, and get an idea of those. Start there. And at the same time, while you're waiting for those results, Question the quality of your water, how much you're drinking, question the quality of your food. See if you can go and source healthier food in the area, question your level of exercise. Is it not enough? Is it too much? Is it detrimental to a certain body part? What about your sleep? Are you looking at social media before you go to bed? Are you drinking alcohol before you go to bed and waking up at 2 a.m. going, why am I awake? They're the questions you ask while you're waiting for your results. And
Yeah.
then go back to the definition, the true definition of health, which is how you function, and look at your nutrients, your toxins, and start to adjust that.
Yeah, beautiful, mate. That's very sound advice. And that's exactly what I'd recommend as well, is just like get your bloods done, because it's just going to give you a clearer path, an understanding of who you are and what needs to change in your life and give you direction. But also the fundamentals. You talked about sunlight, you talked about grounding, you talked about the quality of our water, the quality of the air we breathe as well. All those things can make a huge impact. They seem so simple, but we've got to start with the basics and get them right before we start throwing the kitchen sink at it. What does the word healing mean to you now, especially like at this stage of your life?
Healing, if I needed to heal, would be just giving my body everything it needs in order to do so, and believing that it does that really well if it doesn't have any blockages. So once again, if it's getting everything it needs and nothing of what it can't have, it will do the job. Let's imagine someone in their 90s who might have a degenerative illness as well as being old. If they cut their finger, their body still heals. It's got the ability. So if, for example, you're dealing with a chronic illness or a family member is, just believe that their body can heal. But your challenge is to find out why it's not healing.
Yeah, and
And
give
I
it what
guess
it
we talked
needs.
about those principles.
Yeah, awesome. Jason, we've had a great conversation, mate. Is there anything that I haven't asked you about that you wished I had asked you about?
Mate, I think that's pretty epic. I'd say if people who are listening to this are getting this and understanding there's people like yourself or myself out there that are, this is not medicine. This is not, in opposition to medicine or competing with medicine. It's actually helping people understand health, and they like it. Go deeper, learn, find other people who've got podcasts, read, get information. It's a little bit like recognizing that anyone who's wealthy probably received a really good plan around becoming wealthy, a financial plan earlier. We didn't get that with our health. We were born with our health being full, very, very wealthy. We just spend. No one taught us how to save or invest. But that's how you invest. You learn right now what you've got to learn to be able to be putting more in the health bank than withdrawing. Deposit more than you withdraw.
Yeah, stay curious. I like it.
Yeah.
Jason, if people want to reach out and learn more about you, what you do, where can they find out more?
Mate, on Instagram, I'm really accessible. I answer everyone. So it's Jason Gilbert Official. There, I've got my webpage, jasongilbert.com.au. So on that, for example, I've got the Water Fast book. I've also got Getting Over Spinal Surgery. I wrote a book on that because there's nothing out there. And you know what, mate? I've got actually an awesome course that I forget I've got sometimes. It's a video series and a book called Stronger Every Day. And that basically talks people through these principles. And I think it's $40, it's super cheap. It's just, once again, we have to take responsibility and put the time in to learn and not rely on other people anymore when we're sick.
Yeah, awesome. Thank you very much. I'll put some links in the show notes below, mate. But I've really enjoyed our conversation today, Jason. And next time I'm up around Northern Rivers, I'll have to drop in and see you.
I'm going to hold you to it, mate. You'll love it.
For sure.
What's those sharkies down in Streaky Bay?
Mate, there's plenty of them down here. You're welcome to come down and do some surfing if you like.
Epic, mate. Congratulations on your work, mate.
Thanks for tuning in to the Midlife Mavericks podcast. If Jason's story resonates with you, I invite you to take a step towards your own recovery, growth, and longevity. Whether it's back pain, fatigue, stress, or just feeling that something's off, it's never too late to take control. You can connect with Jason at jasongilbert.com.au or check out his book, Stronger Every Day. And if you're ready to take action with the support of other like-minded men, join the Midlife Mavericks school community. It's completely free, and inside you'll find practical coaching tools, training strategies, and the kind of conversations you won't find anywhere else. Click the link in the show notes to join. Don't forget to subscribe, leave a review, and share this episode with a mate who needs to hear it. Your health is your responsibility and your greatest opportunity.